In today's class, we will study anti-diarrheal drug. This is one of the most important topic in the pharmacology. Now, the first term, anti-diarrheal drugs. Anti plus diarrhea. The word meaning is anti plus diarrhea. Anti means against or opposite. Diarrhea means loose stool. Here, anti-diarrhea means the anti-diarrheal drugs are the agents or the medicine used to prevent and control the diarrhea. Those drugs are anti-diarrheal. Now, the definition of the anti-diarrheal, the here anti-diarrheal drugs are the medications used to reduce the frequency, fluidity, volume of stool and provide symptomatic relief in the diarrhea. Here in the definition, it is clearly told there are three things it is doing. The medicines or drugs which reduces the frequency of stool, and second one the fluidity, third one the volume, the quantity. First is the frequency, means continuously for some again and again the patient is passing the stool, one thing. Second one is the watery stool. Third one, quantity of the stool is reducing. Those drugs are called as a anti-diarrheal drugs. Those are and also providing the symptomatic relief from the diarrhea. This is about the definition. Next one, mechanism of action. How the anti-diarrheal drugs are acting. The mechanism of action is, first is the decrease the intestinal motility. You know that the diarrhea is because the infection or the improper functions of the intestine. Here the mechanism of action, mostly the diarrhea is because of the increase the motility of the intestine. These class of the drugs decreasing the intestinal motility. This is the first mechanism of action. Another second one, increasing the water and electrolyte absorption. These drugs helpful for the increasing the water electrolyte absorption. Next one, the reduce the intestinal secretion. You know why the watery loose stools are passing? Because the intestine, the continuous secretion of the water, it means the water quantity is increased in the intestine. Due to that, the watery stool passes. These class of the drug reduce the intestinal secretion is reducing this class of the drugs. Next one, absorbing the toxin and microorganisms. This class of the drug, few drugs are there, those are acts as a adsorbent. Then whenever if you give the drugs, these are absorbing the toxic things as well as the microorganisms and reducing the symptoms. These are the main mechanism of action for the treating. Here, treating infection when indicated. Also, whenever there is an infection, bacteria or amoeba, it is there, that also treating. This is the mechanism of action of the anti-diarrheal drugs. Now the next one is the classification. Here the classification, anti-diarrheal drugs are mainly classified into 5 types. One is the anti-motility agents. The second one, the adsorbent. Third one, anti-secretory agents. Fourth one, antimicrobial. Fifth one is the probiotic. These are the 5 class of the medicine. One by one we will study. The first one is the anti-motility drugs. Just now I told the diarrhea is because increase the motility in the intestine. This class of the drugs decreasing the intestinal motility, reduce the speed of the intestinal function. That's why it is acts as a anti against the diarrhea, and also increase the transit time. It means that all the water and nutrients are absorbed because the speed is reduced. That's why it increases the transit time. The next one, increase the water absorption, because it will take times. That's why from the intestine the water is start absorbing. This is the antimicrobial agents, or this class of the drugs is doing actions. Now the very common drugs are the Loperamide. The very famous brand is NDL or L-dopers. These class of the drugs are acting like this. The second one is the Diphenoxylate. This is also comes under the anti-motility agents. The second one is the adsorbent. Adsorbents, these class of the drugs are like a the dry cloth as well as sponge, like that. Whenever if you are rub it, then all the toxins or microorganisms absorb in the sponge or in the dry tissue paper, like that. It is absorbing the from the intestine all the microorganisms as well as the toxins, and it will expels out. Due to that, the patient relieves, the symptoms will relieve. Here the absorbent are absorbent toxin and bacteria irritants. These class of the drugs absorb uh, toxins as well as bacteria irritants from the intestine. If the irritant is reduced, then reduce the symptoms of the diarrhea. Reduce the stool of frequency. This class of the drugs also reduce the frequency, the continuous passing the numbers also reduces this class of the drug. Very famous is the activated charcoal, comes under this class, as well as the Kaolin and Pectin also coming under this class of the drug. The next third one is the anti-secretory agents. This is the one of the safest drugs in the children's. This is like a reducing the intestinal fluid secretion. Just now I told, in the intestine the secretion is increases whenever the diarrhea, the secretion is increases, water quantity is increases, the person is passing continuous loose stools. If this class anti-secretory drugs, this is reducing the secretion inside the intestine. Due to that, the secretion is reduces, the quantity of the stool also reduces, water accumulation inside the stool, intestine also reduces. Like this, it is treating the reduce the intestinal fluid secretion and decrease the stool volume. This is the mechanism here in the anti-secretory drugs. The common drugs are Resica. The very famous brand available is enough tablet, enough sachet, very commonly, as well as Residot capsule. It is also 100 mg, very common famous brand it is. And also that is bismuth subsalicylate. This is also comes under the anti-secretory agent. The next one, fourth class, is the antimicrobials. The name itself, it is given microbes. Microbes, it may be bacteria, it may be amoeba, maybe parasites. This is acting against. If the person is in the intestine, if there is a microbes are there in the intestine, infection it is there, then this class of the drugs is acting against the bacteria. Infective diarrhea as well as amoebiasis as well as the giardiasis, in that cases this class of the drug, it is treating the microbes. Here very common drugs are metronidazole as well as tinidazole, ornidazole. This is very good acting against the amoebiasis. Next is the ofloxacin, ciprofloxacin. This is also one of the class here. It is acting as a antibiotics. Both these class of the drugs is acting as a antimicrobial agents in the anti-diarrhea. Very common famous brand it is available. O2 tablets, O2 syrup, like that is available. Last class is the fifth one, is the probiotic. Probiotic here means sometimes what happened, if the person is taken the antibiotic or any heavy medications, that time the inside the flora or intestine, the healthy bacteria are killed. Due to that, the persons pass the loose stools, or this is the one of the cause for the healthy bacteria lost. Due to that, the diarrhea start. In this case, the healthy bacteria or gut flora is maintained. Here, the probiotics are restore the normal intestinal flora. It means this class of the drug is maintaining the good bacteria in the intestine. Due to that, the intestinal flora is maintained and reducing the loose stool. This is also one of the anti-diarrheal drugs, as well as it is acting shorten the duration of the diarrhea. This is also probiotic, comes under the probiotic. And very famous here is the common brands are the you may heard about the lactobacillus sporolac tablet or sporolac sachet, as well as the derolac sachet. This is comes under the probiotic. The next is the therapeutical uses. In which diseases the anti-diarrheal drugs we are using? So the very common is acute diarrhea, as well as the chronic diarrhea, traveler's diarrhea, infectious diarrhea, irritable bowel syndrome disease, and antibacterial associated diarrhea. In these diseases we are using the anti-diarrheal drugs. The next one, adverse effect due to this anti-diarrheal. The Loperamide drug, the very common, you can see the constipation. If you have taken the excessive dose or large dose, then very common seen adverse effect is the constipation. Second one is the abdominal cramps, also because of the Loperamide overdose. The next one, bismuth subsilicate. Here the very common adverse effect, the black stools, the persons feel the black stools. The next one, this class, that is diphenoxylate, the drowsiness as well as the constipation. These are the adverse effects seen in the patient. Next is advantages of antidiarrheal drugs. Advantages here, reduce the stool frequency. It means the continuously the patient is passing frequently the loose motion, then it is reducing. Next is prevent dehydration. Because of the watery loose motion, the dehydration is the one of the main. This class of the drug is preventing. The next one, reduce the normal bowel function. This class of the drugs, that is specifically probiotic, is the reducing the normal bowel function. Next, improve patient comfort. This is the main advantage. These are the main advantages of the antidiarrheal drugs. The next disadvantages is constipation. It may cause, if the overdose or excessive tablet continues for a long time, it may cause the constipation. Next one, may mask the serious infection. Just now I told, if the cause of the diarrhea is, it may be infection. If you are giving this class of the drug, anti-motility drugs, the only the motility is reduces or the speed is decreased, but the infection is inside the intestine. Due to that, the increases the serious infection. This is one of the disadvantages, may risk the serious infection. This is the disadvantages. Next one, common brands available in the India. The commonly Loperamide brand. This is the anti-micromotility agents. The Loperamide common is NDL or L-dopa tablets, and Resicadotril. The common brand is Residotil, Resdot or enough tablet or capsules sachet. Next one is the metronidazole, the Metro IV fluids, Metro IV or Flagyl tablet. And next one is the Lactobacillus. The common brand is Sporolac as well as the Derolac. These are the common brands available anti-diarrheal drugs. Hope you understood the today's topic. If you understood, please share to your classmates and friends, and also like, share and subscribe. Thank you.